Hi, my name is McKenna Carithers. I'm going to be treating you today. Could you tell me your name?
Welcome. I'm Dr. Shehu Yahya. Well, the name of the patient, Saeed.
Okay, could you tell me a little about yourself? What do you currently do for a living?
Where is she's a tea trader.
Okay, great. Do you have any children or are you married?
Kina da miji, yaranki nawa? She's married and she has 2 children.
Oh, that's great. So could I ask some questions?
Yes.
Okay, so what brought you in here today?
Wai me ya kawo ki asibiti, me yake damunki? Kin ce da zazzaɓi da mutuwan jiki ba? Okay. She presented here with complaint of fever, headache, generalized body weakness, and dizziness for 2 days duration.
Okay, could you tell me a little bit more about your fever? Does your fever come and go or is it continuous?
Shin zazzabin da yake damun kin nan wanda in ya zo ne kawai zai yi ta yi baya tsaya ko kuma wanda ya ɗan tsaya ya zo ya ɗan tsaya ya zo? The fever is a fever that is on and off, intermittent.
Okay, does the fever get worse in the evenings?
Shin zazzabin yana fin yawa idan yamma yi? Yes, it's usually worst in the evening.
Okay. Do you have any other symptoms?
Shin kikan samu matsala in an baki wani magani ya za miki ƙuraje? She has no non-drug allergy.
Okay, does she have any abdominal pain or diarrhea?
Akwai ciwon ciki ko zawo? No abdominal pain, no diarrhea.
Okay, could you please take her temperature for me?
Yes, by our recording with our thermometer here, the temperature recorded was 37 degrees centigrade.
Okay, thank you. And could you also take her heart rate?
I didn't get your question.
Oh, could you please take her heart rate?
Okay, wai shekarunki nawa? She's 20 years old.
Okay. So I suspect that you have malaria. So I'm going to run a rapid diagnostic test for malaria, and then I will also run a full blood count to check for anemia because anemia is commonly associated with malaria.
That's beautiful. That's beautiful. Yes, of course, the diagnosis is malaria. And when you run your rapid diagnostic test, that's the RDT, of course, it will show whether it's 1 plus, 2 plus, or 3 pluses. Depending on the number of pluses, is indicating the severity of the malaria for you. Our it is just plus, which means it is simple malaria. You can also run a blood smear for microscopy. In your microscopy, you can be able to identify the egg of the parasite, that's like ova of the plasmodium parasite, which will show you it is an infection of plasmodium within the blood. Even the microscopy too may indicate 1 plus, 2 plus, 3 pluses, depending on the severity. So in her own case, it's just 2 pluses, meaning it's a simple malaria, just as you suggested. But how can you treat this simple malaria?
To treat uncomplicated malaria, I'm going to prescribe an oral ACT.
Yes, it's beautiful. The first line treatment for simple or uncomplicated malaria is artemisinin in combination therapy. The patients are doing well on it. What advice will you like to give the patient to prevent future occurrence?
To prevent future cases of malaria, I would recommend wearing long sleeves and long pants when you sleep, and also using a mosquito net if you have one, and applying bug spray to your skin if you have that available.
Excellent. That's very good. Very good, I think. Yes. It's good. It's very good. It's as good as the treatment itself for you to advise your patient on the preventive measures. If not, the patient will still come down with the disease. There could be relapse or reinfection from the disease. So also, yeah, in addition, you may wish to advise the patient to cut down bushes around the house and improve on their drainage system by doing sanitation. Here in our own setting, we don't have good drainages. You find out gutters around the community, which provides breeding ground for mosquitoes, where they breed and then come to the communities and take blood meal from people while spreading the virus within the bloodstream. So it's a very nice attempt. I'm really happy. I wish you will be one of us, of course, a doctor. So is there
Okay,
any contribution you may wish to make?
thank you for answering my questions, and I hope that you recover quickly.
Thank you. Tana miki addu'a wai Allah ya sa ki samu sauki.